Hi everyone, this is Dominic. Thank you for watching my video. Today I'd like to share another piece of advice for therapists and trainers that can be used in treatment. Our topic today is about stretching techniques for the alternative pain-relieving muscles on the front of the thigh. There's a very large muscle group on the front of the thigh called the alternative pain-relieving muscles. Approaching these alternative pain-relieving muscles can be surprisingly tricky. Today, I'd like to introduce a more practical approach to working with these muscles. So, let's get started right away. First, let's look at the location and anatomy of the alternative pain-relieving muscles. The alternative pain-relieving muscles are located on the front side of the thigh. As the name suggests, it's a group of 4 muscle bundles combined into one. Out of these 4 muscles, 3 of them, the middle, inner, and outer vastus muscles, originate from the femur. These muscles start at the femur, pass through the patella, and connect to the tibia and fibula. So it's crucial to understand how well you can bend the knee joint. Being able to achieve a full knee flexion position is important. When flexing the knee, imagine a rotational movement around the knee joint and try to drop your heel towards your buttocks. If you feel any discomfort or resistance in the knee joint when moving straight down, apply a slight traction and push gently downward and diagonally towards your sit bones. This will help you achieve a greater stretch sensation. The more fully you bend, the farther apart the start and end positions become, creating a position where the stretch becomes more effective. The remaining muscle is called the rectus femoris. Unlike other muscles, the rectus femoris starts from the pelvis and crosses over the hip joint. Therefore, to stretch the rectus femoris, you need to bend the knee joint while keeping the pelvis fixed. I'd like to consider stretch patterns based on this structure. The first approach is for the posterior muscle group. For the posterior muscles, the knee flexion angle is crucial, so we'll focus on bending the knee joint as the axis. We'll rotate the heel towards the buttocks in a large circular motion. One approach to this stretch is to lift the knee. When you lift the knee, all the muscle lines starting from the front of the pelvis work together, allowing for a greater stretch. This approach involves deepening the knee flexion angle while keeping the knee lifted. Many therapists and trainers practice this method, but there's one point to be cautious about. The concern is that the more you lift your knee, the more your pelvis tends to rotate forward. As the pelvis tilts forward, creating what's known as an anterior pelvic tilt, it inevitably puts more strain on the lower back. In some cases, when the lower back arches, it can create a sensation of tightness or clogging at the base of the spine, particularly around the sacrum area. You might feel discomfort or anxiety in your lower back before you even feel the stretch in the front of your thighs, which can prevent you from achieving a proper stretch. As I mentioned earlier, the muscle known as the rectus femoris, which is on the front of the thigh, originates from the anterior inferior iliac spine of the pelvis. The more the pelvis tilts forward, the closer these attachment points come together. The movement looks something like this. When you lift your knee with the knee joint in a bent position, the pelvis rotates forward. This forward rotation causes the area around the anterior inferior iliac spine to bunch up as well. As a result, it becomes difficult to create distance between the starting and ending positions of the stretch. So it's important to move the pelvis in a backward tilting direction. The more you tilt the pelvis backward, the more you'll notice the lower anterior iliac spine moving forward. Do you see that? This is the kind of movement we're looking for. When the lower anterior iliac spine moves forward, it means the starting and ending points of the muscles are moving further apart, which creates a greater sense of stretch. We're aiming to bend the knee joint while keeping the pelvis tilted backward. This is what it looks like. This concept is crucial when approaching alternative pain relief techniques for muscles. Now, how do we achieve pelvic posterior tilt in a prone position? Of course, the therapist can apply pressure to the back of the pelvis, which will rotate the pelvis itself. However, if there's an asymmetry, moving this large pelvis with just the therapist's hands can be quite challenging. So in such cases, we place a cushion under the lower part of the pelvis. On the front of the pelvis, there's a protrusion called the anterior superior iliac spine, or ASIS. We're going to place a towel to cover this protrusion. It should look like this. If the towel slips off the pelvis and goes under the stomach, the pelvic movement will be reduced. So instead of putting it under the stomach, place the towel so it slightly covers the front of the pelvis. This will naturally create the desired pelvic movement. This position will tilt the pelvis backward, allowing you to bend the knee joint from here. If you want to increase the intensity, you can slightly lift the knees. I think it's a good idea to work on improving knee joint flexion by incorporating these small techniques. It reduces the physical strain on therapists and trainers while providing a significant stretch for the recipient, so it's worth keeping this approach in mind. The same concept can be applied when lying on your back. When stretching the hamstrings while lying down, it involves bending the knee. However, when attempting this movement, you'll notice the hip joint rotating inward. The knee is significantly bent with the thigh area facing outward, causing the femur to rotate internally as the femur turns inward and the hip joint moves into extension. The pelvis tends to tilt easily. The hip extension and pelvic anterior tilt are interconnected, so it's crucial to keep the upper body upright during this movement and allow the pelvis to tilt backward while standing. I think it's helpful to place a cushion under the sit bones. Placing a cushion under the sit bones looks like this. When you put a cushion right under the sit bones and hip joint, it causes the pelvis to rotate into a posterior tilt. Once in this position, bend the knees as much as possible. This creates a significant stretch while protecting the lower back. When stretching the hamstrings, remember these two key points: pelvic posterior tilt and knee flexion. It's good to approach the stretch while keeping these two aspects in mind. This applies to both self-stretching and when performing the technique during treatment. I recommend firmly remembering these 2 points. I'll include more detailed approach methods in the summary section. If you're interested, please check that out as well. That concludes today's video. Thank you for watching, and I look forward to next time.